Hello, and welcome to Education is Best Medicine, uh, sponsored by the Eyes of Conscious Soul. Got started a little bit late here due to, as they say, technical difficulties. Anyway, I wanted to say welcome and thank you for tuning in to Education is Best Medicine, supported by Eyes of Conscious Soul. And just a little bit about our lineup. Um, 24-hour inspirational gospel channel. I want to thank Believe Radio and Curtis for his support, etymology, all the folks to make the program possible. The Eyes of Conscious Soul with Sister B Mello will be the first Saturday of the month from 2 p.m. to 3 p.m. Cafe the Blue Lounge, 15 to 45 minutes segments called The Corner, which I did last week. Each corner has a blueprint that is unique in its own for relaxed vibes, cool soul, fireside chats. And then we have Artist Talk in that second corner. And then the third corner, Live Legacy. Um, the second Saturday of the month from 2 o'clock to 3 o'clock is the Medicine Hour with me, George Pearson, and co-host Sister B. Mello, Miss Howard. And again, she says, and I say this is where we are building a better tomorrow. It starts with us. We cover general topics like health and health concerns and eating habits. And on the third Saturday of the month, from 2 o'clock to 3 o'clock, is Education Best Medicine. Here we are, hosted by the founder of Education Best Medicine. It's a 501c nonprofit. We discuss health education advocacy, and gonna be looking at my vision statement and my mission, and maybe gonna introduce that to you as an update on where we're going, where we're headed. And the fourth Saturday every month is the Kitchen Table. That's hosted by Miss Barbara Harbert, aka Sister B Mello, and I co-host with her on that show. And look forward to you folks checking us out. Want to talk a little bit today about a couple of things. But what's really been pressing me, I think, in my practice and the day-to-days, and maybe we can draw some interfaces and correlations with, what's going on today with COVID. And I don't care whether you old or young, gay, straight, undecided. Uh, 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 we are having a discussion around vaccination versus partial vaccinations, no mask versus a mask. I believe COVID is the gift that keeps on giving. It is our generation's polio, malaria. Give, just decide. And if we look at those public health efforts, those efforts required long-standing commitment to, one, find out what the problem was, and two, fixing it. So I think that's why these things should be science-based, and we need to continue to understand that the data is ever changing. I think what kind of concerns me around the society right now is that we want a quick fix answer to everything, and the lies become truth and truth become lies. So I did some retrospect and kind of looked at where we're at with COVID, and in particularly this new presentation of the RNA virus, particularly B4 and B5. And they call it B4 and B5 the great Houdini, and I call it Hercules because, man, it's strong as heck, and it's beating off all challenges. And I think the concern we need to have is that now the COVID that the past president Trump got is different than the one we're dealing with now. And it is, for the most part, evading the vaccines that we have presently. And so what we're seeing is people getting multiply infected, and it go through families. In fact, again, it's B4 and B5 are the dominant variations in California, at least. And recently there was a some discussions around just across the nation. Governor Justice reported a national COVID says 6 times higher than 1 year ago. Again, COVID's not going anywhere. It's not going to go away. We have to learn how to live with this and live with the implications of it changing and morphing before our eyes. That's the interesting thing. A lot of the folks that are studying this for infectious disease, microbiologists, and they've never seen anything like this. I've never seen anything like this. I can think of the flu, swine flu that converted to the flu we're now vaccinating for. I can think about it in terms of HIV and the need for the treatment of HIV changed with the treatment of the heart protocol, and which show that when I first started practicing, you were giving at least 12 pills to individuals with HIV. Now it's 1, 2, maybe even 3. And better treatment. But again, these are the long life treatment. So again, if that is required, a 3 drug regime, in some cases 4, to beat back our HIV virus that was always morphing, was always changing, then we are at the same crossroads of COVID with this particular virus always morphing, always changing, thereby the need for vaccinations. And if I didn't, I'm going to show you the best treatment for COVID right now. It's prevention. It's wearing your mask. The masks are not gone. They need to be a part of your regular lifestyle. Unfortunately, again, what happens when people don't wear their mask, the virus mutates, and then we have a different virus that that the medicines can't keep up with. And so, again, with I'll read you some data about people that are vaccinated versus non-vaccinated, but I want to carry on this conversation by, again, solutions, right? Solutions is to wear your mask. And wear your mask until at least the kids from 6 months to 4 years are vaccinated. Now, talk with your doctor. We're educational, but I try to line up with the data, and this is a conversation that we need to have as we move forward. And I guess what I was concerned about is, particularly in Alameda County, there's been a 0.7% increase in new cases, something like 2,100 folks in Alameda County. That doesn't seem like a lot, but multiply that by folks that aren't vaccinated, partially vaccinated, and children and families that aren't vaccinated. And then you have a recipe for a virus that keeps morphing and changing. Add on to it communities over the world that have no access to the vaccine and have not been vaccinated. Watch China. China is a real representative of how this virus is morphing and what they've tried to do in terms of zero policy. If you don't know what the zero policy simply states this: when they have a number of cases, 1, 2, or 3 in that community, they shut down the entire community. That's why we've had such an issue with global supply chains, because the government of China has the ability and the power to shut down entire cities, which in tune manufacturing, all those things get shut down. So, of course, China has been the major supplier of things in the world, of your Apple computer, of your transistors for your cars. Again, dependency is an issue. So, I think the biggest concern for me is this is, again, an underreported now, identified epidemic, because people are now flying, mask off, traveling everywhere, and the virus is morphing before our very eyes. It got brought to my attention as a lot of people I cared about and care about, patient family members, were getting COVID. It was absolutely astounding. It was like 2 or 3 weeks, entire families, entire patient groups, positive COVID. So again, this is not going anywhere. We need to wear a mask. We need to get vaccinated. We need to understand that we need to be intelligent about our exposures. It says that so the Centers for Disease and Control report that on December 14th that 85% of adults aged 18 or over in the United States have received one COVID vaccination, but 15% remained unvaccinated. Now, again, if you think this is underreporting, I think it is. It's probably more like 30 to 40% that are unvaccinated. And when you asked, um, unvaccinated adults, and again, this is per CDC, when you asked unvaccinated adults about why they weren't getting vaccinated, half report they were concerned about possible side effects of the vaccine. So, spoiler alert, what's worse than death or, in now this case, because this is now turned into a chronic illness, long hauler syndrome, and we'll talk about that. And again, there's some confusing issues around the definitions, but suffice it to say that this is post-infection with COVID, the alterations in brain function and energy. Simply that. Common complaints are fatigue. Common complaints are just, can't think straight. Okay. And that's just the things that are common. It's about 200 symptoms in this long hauler syndrome. So we're not done with this yet. That will be my constant refrain. COVID isn't over. We're not done with it. We're not done with it. We may be done with it, but it's not done with us. And it says 42% report they don't trust the COVID-19 vaccine. I wonder why. How could treating this public health issue become a political statement? Well, when you had the prior president discussing some of the draconian and weird and definitely unsafe things for treating this, I think something like drinking bleach and, just absolutely just bizarre. Then you have what I say is really the true number about who hasn't been vaccinated and who's not talking about it. So I would say more, maybe even 50%. And I want to give the current administration a shout out because they have been in the eye of the storm. And I think folks fail to realize this pandemic has only been around for 3 years. 3 years. That's not a long time. Not a long time. And the common discussion is not enough is being done. Well, and when 42% of people don't want to get vaccinated, you get what you pay for. You get what you deserve. And again, the discussions around the increases in exposure and hospitalizations as the tip of the iceberg. Because, again, remember, children 6 months to 4 have not been vaccinated, just approved. What families are or aren't going to get their kids vaccinated? I hope they don't take that risk. Because if you can still die from it, if you can still be made sick from it, in your child, that's going to be 100%. And again, we don't have really good treatments. We modify things. Let's say, watch China. The zero policy, the lockdown. And one of the issues, again, with COVID is a lack of access to vaccines worldwide. Big thing around monkeypox, right? And and again, driven by exposure. Um, and some say one of the spreader events was a rave party in Spain. Uh, Although on the African continent it's kind of been dealt with, it's still a problem due to exposure. Uh, some say in the gay male community, exposures, unbeknownst to them, open lesions, their skin to skin exposure. That's what they're seeing. But the bottom line is that they have a vaccine that can treat it. Let's treat it like a public health issue and keep it moving. Um, so, in the uptick in the new variants, B4 and B5, Houdini Hercules, I call them, still increase the risk, and it's a major issue against is long hauler syndrome. Um, and now we're seeing like 20% of the new infections and reinfections are from the B5 virus, and 30% unvaccinated uh, puts us at risk for multivariant exposures. Um, they talk about adults who did not receive any dose of COVID vaccine, different from those who have received at least one dose of COVID across several measures. On the average, they were younger. Said they were younger on average than those who had been vaccinated. Roughly 75% unvaccinated were under the age of 50. Read it again. Roughly 75% unvaccinated were under the age of 50. Among the vaccinated, less than half were under the age of 50. So is this becoming a young person's pandemic, epidemic? I don't trust the government. I don't trust Western medicine. Maybe. The parallel I draw is in China, where the elders in China won't take the vaccine. They don't trust Western medicine. It says something about how we communicate, how we talk, how we share in a Western medicine model, and why we need to change because it's not effective. It doesn't get us where we want to go, which is 85, 9% of folks vaccinated. Then you can talk about herd immunity. You can't talk about herd immunity unless 3/4, and I'm saying more like 85 to 90% of people are vaccinated. No way. Those that weren't vaccinated had lower levels of education. Those who then were vaccinated, survey of respondents had received at least one dose, were twice as likely as the unvaccinated to have a college degree or higher. They were less likely vaccinated adults to be married. Interesting, huh? The question is gender, right? Males versus females. Who's more likely to not get vaccinated? Racial and ethnic differences. The share of unvaccinated. This is right from the CDC's current review of COVID-19. Yeah, who you're basically asking who's vaccinated, who wasn't vaccinated. That's who they looked at. The share of unvaccinated, non-Hispanic white adults was not different from the share who were vaccinated. The same was true for Hispanic adults, but non-Hispanic Black adults were slightly more represented among the unvaccinated, meaning African Americans. About 13%, the unvaccinated 11%. A small but statistically significant difference. So here we are with a number of group of folks that are under 50 and definitely people of color that are not vaccinated. Again, they create a dynamic for the virus to become resistant to the vaccine and any of the current therapies because it continues to morph, continues to change, continues to be a Houdini, to be a Hercules, to evade and to be stronger than the therapies that we have right now. In other words, all bets are off now because even if you are vaccinated, this particular variant B4, B5 evades the current vaccines you have aboard. That's why we have to get revaccinated. This is the same thing in flu, swine flu. Same thing in HIV. That's why the treatments for HIV and for flu are the way they are, because they had to develop therapies for the variants of those particular diseases. Anyway. And again, easiest way to treat this is masking, do what we need to do. And also want to bring to your attention that you're listening to Believe Radio. It's a gospel and music station that has agreed to carry our content. I really appreciate it. I really appreciate my Facebook family that I'm developing and growing. And they keep disabling my account for some reason. I don't know why they keep doing that. I've done it like about in the last week. I've had to reset like 3 times. Anyway, another discussion. Keep watching, keep listening. Please tell your friends. And again, Believe Radio. We are a 24-hour inspirational gospel music station, and our row of shows, the Odds Conscious Soul with Sister B Mellow. She comes on the first Saturday of the month from 2 o'clock to 3, and she has 3 segments of the Cafe Le Blue Lounge. And we're calling it The Corner, and The Corner has first corner is artistic talk, the second corner is Why I Dream, and third is She Who Believes and Takes Off the Mask. So, interesting dialogue, interesting concept. Please give her a listen, and she should be back next week. Every second Saturday of the month, 2 o'clock to 3 o'clock is the medicine hour with myself, George Pearson, and again, my co-host, Sister B Mellow, Miss Barbara Howard, and family. Say hello to the family back from vacation. Interesting vacation. They had a great time. Glad when Black women can take care of themselves, and Black women. I tell the women that I take care of that stop. You have to take care of yourself first. If you don't take care of yourself, you can't take care of anybody else. And one of the things that women of color tend to do is they're the last to take care of themselves. My mother totally fit that model. Want to say hello to my sisters too, friend Jessica and try something. Hey, and their daughter, my niece. She's Kay's right. I wear my hair the way I do. Both my babies are miracle babies. My sister's daughter and Kaylee, my great granddaughter. And third Saturday of the month from 2 o'clock to 3 o'clock is Education is the Best Medicine. Really, we take from 2 to 3. And it's hosted by me. And it's a 501c nonprofit organization. I try to do community-based health education, advocacy, and resource-based organization that uses public media and radio, newspaper, church-based organizations to provide information, education. One of the things I say that I believe vision is the art of seeing things yet unseen, and we try to bring light to a very dark world. Then the fourth Saturday of the month is Kitchen Table from 2 to 3, hosted by Miss Barbara Howard, Sister B Mellow, founder producer of the Eyes Conscious Soul, and I'm her co-host, and so we'll keep it moving. So we had again, in reviewing for this show, I just kind of like COVID stopped me in my tracks, so I had to address it. Um, and again, if I can say anything, put the mask back on, remask, stay away from closed areas. These events, they're going to become spreader events for a lot of people with this B4. It's more infectious and it goes quicker. B4 and B5 now are the dominant variants in California and the nation. Um, and some of the current thoughts was in an update from Dr. Ariko Shika, she's PhD in infectious disease, and it was an AMA update. This is 100,000 new infections, and folks are still dying. The issue is infections and long COVID. Again, we're going to talk about long COVID because it's interesting. It's the variation on a illness, the chronicity of the illness. That's why we understand that COVID is a chronic disease now. And one of the things that's concerning me is we're probably not getting the full numbers. They're probably underreported. We've got home tests. People stop reporting. Again, we are actors, so this is over. And COVID, by the numbers, the average from June 13, 2022 to June 19, 2022, unvaccinated people were 5.3 times more likely to get COVID than people who received their booster dose. Latino, Black, and low-income people with inadequate health care could suffer the most. California doesn't have as many COVID specialists, and disadvantaged communities are always underserved. And I speak specifically to African Americans post 1619 and the ones that are talked about in the current white people on reparations. I think that's specific. It says that long COVID is not mysterious, caused by infection in the COVID virus. Debilitating and difficult to diagnose compilation of post-infection problems that have been affected perhaps millions of Californians. This is the definition of California. And health experts fear that the toll will be especially harsh for Latinos, African Americans, and low-income residents who already face a disappointing impact from COVID, as well as less access to quality health care. We see this too much as a repeatable picture that we don't, in communities of color in Pacific, African American, Latino, poor communities of color lack the access, lack the clinicians, lack the medicines. So the impact on us is doubly, is a double. It's a double risk, again. And what they say is some vast regions of California have few doctors experiencing and diagnosing and treating long COVID conditions. Well, it's because it's new. Unless you're working in a university center or working with folks that I work with, you don't see it. I can say that when I was in the community health clinic in Vacaville, right after COVID, I started seeing people that were having symptoms that just hung on. They were always tired. They just couldn't think, they were just, they were sick. And I think that one of the things that happens when people of color say they're sick, so when America gets a cold, people of color get pneumonia, particularly African Americans, Latino, poor communities of color. And we're not to be believed because, one, the folks that are running these systems now are overworked and underpaid. So they don't have that sensitive ear. The great resignation wasn't only of people in frontline work, it was about a number of healthcare workers that decided that they did not want to be exposed to COVID. And even though they're saying there's no issues with fertility, a number of the women that I talked to, that's what their concern was, their fertility. So we have a large population of young white females that were concerned that they could get exposed to COVID and not be able to have children, to be able to have family. And I thought that was totally real because we don't know yet. We haven't seen it. It's going to take about 5 years to figure out if there's any effects on fertility. I kept saying last year that this COVID pandemic was not over. We were just getting the beginning of it, and I was just kind of like, it's always when you're the clarion for what people don't want to hear, it's always an issue. But here we are. Um, Now, what's good is that some of the collectives and university centers are starting to put together COVID teams with primary care, cardiologist, neurologist, a whole team. This kind of would reflect a patient-centered medical home where uh, the person can get all the services in one site, particularly medical and mental health issues. That should be the model. We don't need hubs. We need centers. Particularly in this area, we need an African American healthcare center, and that's not to say that no one else should have healthcare centers. Oh well, Native Americans, Latinos, Asians have their own healthcare center in this area. What's the issue with African Americans having a healthcare center for themselves? Again, institutional structural issues, racism, say that we can just be given care by anybody, and so that's why our outcomes are so poor. That's why we die quicker, because we're not important. We're not important. It says studies estimated more than 1 in 4 COVID patients experience symptoms that last for months, known as long haulers. In California, that could be many as 2 million people among 8.5 million COVID cases may have long COVID, including more than 100,000 African Americans and 1 million Latinos. And again, this is another wave that's coming. And they're saying COVID as a long hauler is looking anywhere between 4 weeks and 3 months after the initial infection. People complain of cough, fatigue, cough, brain fog, but there's about 200 symptoms that are not discussed. We want this over. That's why we're not masking. That's why we have been vaccinated, but it's not over. But it's hard to know how many people are actually, and this is going to get from the CDC. It's hard to know how many people really have COVID, because it's, in terms of long COVID, how you really define the U.S. Center for Disease Control and Prevention says symptoms are considered long term if they last more than 4 weeks after infection. The World Health Organization says at least 12 weeks. Long variance there, right? But however you define it, if you think it's too long, you're too tired, and you don't feel well, and everyone else is doing fine but you, then it's an issue to you. So again, UCLA, so they've put together long COVID teams. They include four primary care doctors, evaluate patients, and conduct them to the appropriate specialists, cardiologists, neurologists, pulmonologists, psychiatrists, but hopefully those folks are all in the same area. You don't have to take 2 buses to see them, because that's the problem, especially here in communities of color. From your initial point of treatment, you have to go to another facility, and there's always a delay. I don't care. It's always a delay. Unless you're on the phone with the specialist asking them to see the person a little bit earlier. And of course, they're backed up. What COVID exposed was the fragmentation in the healthcare system and its lack of continuity, its lack of fairness, its lack of ethics, and its increased burdening cost. And what I mean by that is that we still have situations where people are bankrupt by their healthcare problems. That shouldn't be. And as I said, the community suffers from fragmentation in care. It's the legacy of treatment or lack of care, and they don't want to treat us. And from studies, particularly for African American, a person-centered medical home we see that as the best option for us. Uh, and everyone has a center, but uh, African Americans, Asian, Hispanic, LGBT communities can claim those kinds of services are specific for them. But the descendants of the 1619 Project and the white paper on reparations in California speak to a different discussion. And I think we need to make sure that those folks are included in the next series of healthcare decisions. And which brings me to the Department of Healthcare Services Comprehensive Quality Strategy of 2022. And it was using, it's a centralized, it's a plan for next 10 years. It's a centralized reorganization of quality and healthcare equity management. And it says that it defines the best practice for disparity reduction, design, implementation, disparity reduction efforts in collaboration with programs to ensure all efforts include anti-racism framework, leverage community partnerships, and provide executive level leadership on health equity. Why is that important? Because it's never been done before. We could go to clinics, we could be seen, and we were checked off as a person that came in, seeing them, and we were African American / Black. Understand, Black is a different diaspora than just African American. They're separate diasporas. African American speaks to Africans born in this country or enslaved to this country, starting in 1619 to the present, and discussion around the reparations white paper in regards to Africans in America. And so now the questions of equity and disparity and come to the table. And what the HCC said was that as a part of its health equity roadmap, the Department of Health Services recognized to truly address structural racism, communities and individuals have been historically marginalized and need an active voice in informing and designing the Department of Health Service programs. So in other words, we understand that you can't make a cake if you don't have the cook in the room or the person that's going to consume that cake. I use these analogies because it makes people kind of understand what I'm talking about. You can't not make a decision about me and not have me a part of that decision. Whether it be housing, whether it be policing, whether it be education. You can't want to reframe education for what you want people to learn or not learn because you think it will hurt them. You can't paint that picture anymore. It isn't a valid picture. It's one that shows how small the vision is and how fearful folks are of change. So the Department of Health and Human Services in California has a dynamic plan. It's a 2020 plan. It states that, and this is in relation to COVID. It says the long view of health and wellness in California, COVID pandemic with its result school closures, changing healthcare access and stretched delivery systems has had a significant impact on Medicare members. So the poorest of us, the most affected of us, has had vis-a-vis the COVID the most adverse impact and income, outcomes and impact. It says that the physical and mental impacts of COVID have been especially marked for children and parents with declining rates of preventive and prenatal care, higher rates of depression, anxiety, substance use, poor maternal and infant outcomes. Well, that has always been. When I first started practicing in 1982, women of color, African American women from the 16th, 19th discussion, and L who reflect the white paper were dying in pregnancy. My mother almost died in pregnancy, having me. My great grandchild who we lost, my great my grandchild who we lost, her daughter was a preemie, 2.27 pounds. Now she's a cutie pie. And she likes her granddad, which is, you know, peculiar taste, but she likes me. So I am a right to lifer. I believe in the sanctity of human life, but I also believe in a woman's right to make a choice. We're going backwards now. My granddaughter, my granddaughters will have less rights than my mom had. Imagine that. We're going backwards. What President Biden said, we're going backwards. We're going backwards in terms of women's health, voting rights, safety. Ah, safety. Um, and just as an update, last week I discussed racial terror as a tool used by young racists. We thought it was, we said with all the old guys like me die out, racism will end, right? Yeah, the old guard, right? But I guess the folks in Boston didn't get it or didn't get that memo. What we know so far about the white supremacist march through Boston. Remember, white supremacists have been designated as the number one terrorist group in America. White supremacists, not African American ex-Panthers. White supremacists. Boston police and federal authorities are investigating after a black actress was allegedly assaulted by white supremacists who marched through downtown Boston last week. What's up with that? Who should be scared of who? Who's worried about being attacked? So, again, from the reparations paper, after slavery, white Americans frequently aided by the government maintained badges of slavery by carrying out violent intimidation against African Americans for decades. Racial terror pervaded every aspect of post-slavery black life and presented African Americans from building the same wealth, political influence as white Americans. African Americans faced threats of violence when they tried to vote, when they tried to buy homes in white neighborhoods, when they tried to swim in public pools, when they tried to assert equal rights through the courts or in legislation. White mobs bombed, murdered, and destroyed entire towns. Federal, state, and local governments ignored the violence, failed to refute it or to prosecute the offenders. Ask Emmett Till. The arrest warrant for the woman that accused him of whistling at him or whatever she thought he did, this was found on the floor in the courthouse. The family is asking to be served. When would justice be served? Because if justice not served, is justice denied. You can't tell me it's the same system. You can't tell me it's a fair system. Racial terror takes direct forms such as physical assaults, threats of injury, and destruction of property. It also inflicts psychological trauma on those who witness the harm, injury. Many African Americans have been traumatized from surviving mass violence by constant terror of living in America. It says the South, but I'm saying living in America. Lynchings in the American South were not isolated hate crimes. Uh, you get the picture. And again, on my birthday, white supremacists march in Philadelphia on July the 4th. You get the picture. Those are racial acts of terror to intimidate. Have to be African Americans first. You will not replace me. There were good people. January 6th was just the good old boys getting together to just kick in the Capitol. Eh, okay. And which brings me to the Civil Rights Act of 1964, with a long struggle for freedom. Well, then it says that during, and I went back. So I went back to, I was 1 year of age when the Civil Rights Act was created. It says during 1956, a group of Southern senators and congressmen signed the Southern Manifesto vowing resistance to racial integration by all lawful means. This is our history. So, is this the history that we're not supposed to be taught? Is a history that needs to be sanitized so that one group can continue to impose psychological and racial trauma and terror on another? Because this is the history. Resistance heightened from 1957 to 1958 during the crisis over the integration of Little Rock Central High School. At the same time, the leadership of Conference on Civil Rights led a successful drive for passage of the Civil Rights Act of 1957 and continued to press for stronger legislation. The NAAC Youth Council staged sit-ins in white-only counters, sparking a movement against segregation and public accommodations through the South in 1960. Nonviolent direct action increased during the presidency of John F. Kennedy, beginning with the 1961 Freedom Ride. So the reason why I brought that up because of Roy Wilkins. He was the longest serving NAACP leader. Roy Wilkins from 1901 to 1981 was born in St. Louis, the son of a minister, while attending the University. You know, it's very interesting that African Americans throughout have been supportive of religion and supportive of God getting through the most difficult times. But as I think about that, I remember Martin Luther King was assassinated. He didn't live an old life. Malcolm X was assassinated. John F. Kennedy was assassinated. This Chinese minister, SouL, was assassinated. And he was just talking. The the head of the I think it's the CIA. He was saying that people were taking out their aggressions in a violent manner. In other words, we used to talk about these things. Now people don't want to talk about them. They want to enact violence, racial terror on people because of how they feel and what they believe. I think that we have to take a really, really strong look at ourselves and decide how we want this to go. Because if we don't make a change, it may not be around for us to make a change for. We're having laws passed like now you can carry a concealed weapon. Out of touch, huh? We got 18-year-olds picking up R-15s, buying them legally, and killing. And now you're going to allow folks to have concealed weapons. In Japan, they have the most strict gun laws in the world, and they have maybe the way you have to register for a gun in Japan. Man, if you get through that, you deserve a gun. It's about 8 steps with retraining if you continue to carry the gun. Well, you got to go into a store and show an ID in our country, and you can get an R-15 on your birthday. Isn't that interesting? And the reason kind of why I want to kind of like put this COVID issue in perspective is because we don't have really good treatments. We have things that kind of manage and like one of the drugs, Paxlovid, a risk group is for not vaccinated, not fully vaccinated, or high risk transplants. If you're fully vaccinated, this medicine might not help you. Why you need to be vaccinated? Why we need to wear a mask? Why this is not over? We need to be more science-based and intelligence-based, because we're making very, very, very not smart decisions, and it's costing a lot of lives and a lot of. Hey, look, long hauler syndrome, fatigue, brain fog, major, debilitating. And when you talk to young folks and they have this, are they not disabled? Can they not work? If this is how we define, that's why it's so hard to define, because it puts a whole bunch of people in a disabled issue in terms of work. If it's fatigue, if it's brain fog, the two things you need to work on a computer, to do a physical labor job, you gotta have it. If you can't think clearly, or you're too tired to do the particular activity, then Jesus, can't work. I want to thank you for listening today. It's been very, very, very. It's always. I want to thank all the people that watch, all the people that watched me over the years, starting with Education is the Best Medicine, and to continue to follow me. It's going to be moving things more brisker, more faster. And I want to thank you for taking that ride. We're going to reset all the Education is the Best Medicine shows and bring them back. Got about 300 shows, I think. So it's going to be an interesting reboot of those shows, and taking those shows and expanding the format on them and updating them. So I think it's going to be kind of fun, and I think everyone will enjoy it. Again, I want to thank my Facebook family, my YouTube family. Thanks for watching. Thanks for the support. Dialogue, content, informational, as a aside on this, Ken Burns just did a recent piece on mental health in the youth community, in the young community. Let me see if I can find it quickly before we go off. Okay. And I thought it was important. So it's called Hiding in Plain Sight, Youth Mental Illness. So if a guy like Ken Burns, he does these real major documentaries, well funded, for him to pick a subject like that, burning, like baseball, like Muhammad Ali, like jazz, that's huge. Um, I haven't had a chance to look at them, take a look at a couple of the episodes, but it seems to me that if you're looking at young men that are killing themselves are picking up guns and killing people at 18 or less vaccinated, more likely not to believe in uh, the safety of vaccinations, or undereducated, or overeducated and don't believe it, then we got an issue. So I thought it was kind of interesting. It's called Hiding in Plain View, youth mental illness. I want to thank everybody for uh, listening. It's interesting too. It comes up, one of the things that's asked is resilience. How do we build resilience? How do we want to build resilience in ourselves, in our children, and the people that we love and that love us, and the people that we don't love and don't like us? We want people to be resilient. It's time for me to get out of here. I want to thank you for listening to Believe Radio. Hopefully you got a chance to look at the list and repeat the show, share it. And I want to share the last thing, again from Augmendingo, and it's called the God Memorandum. And he says to proclaim your rarity, to count your blessings, proclaim your rarity. If someone asks you to go 1 mile, go 2. Be careful with your power of choice. And I guess the one I like best is to do all things in love. Do all things in love. I want to say have a great July. Miss Howard hopefully will be back next week to do her show. And I want to thank you for tuning in to Believe Radio. Thank everyone that made the show possible. And look forward to talking with you soon. Take care. Good night.